Hello and welcome to Medical Dialogue Journal Club, your daily dose of health and medical news. I am Dr. BP Rahul and I am going to talk about relation between long-term exposure to air pollution and diabetes in Indian population. Air pollution is a critical and manageable risk factor for diabetes, and hence there is a need for awareness about air pollution in the society and at the government level. This was said in the study in the Journal of Association of Physicians of India. The study found that long-term air pollution is associated with impaired glucose tolerance, impaired fasting glucose, and diabetes prevalence. Exposure to air pollution has been shown to adversely impact health through a number of biological pathways and is also tied to glucose metabolism. Only a few studies have investigated the association between air pollution and fasting blood sugar and HbA1c levels, but no study was conducted in the Indian population. To address the knowledge gap described above, Monica Gupta from Sardar Patel Medical College, Bikaner, and colleagues aim to evaluate the association between airborne fine particulate matter, PM10 and PM2.5, nitrogen dioxide and glucose metabolism in a tertiary care center in northwestern Rajasthan. For this purpose, the researchers performed a cross-sectional analysis of 3,457 participants between 30 to 70 years of age group from 5 different urban and rural areas of Bikaner district. The ambient air quality standard method by respiratory dust sampler used to estimate air pollution concentration of multiple air pollutants, that is PM10, PM2.5 and nitrogen dioxide. Diabetes was defined based on the medication prescriptions, self-reported diagnosis, HbA1c and oral glucose tolerance test. Potential confounders including smoking habits, socioeconomic status, body mass index, physical activity and alcohol consumptions were adjusted using a logistic regression method. Based on the study, the researchers revealed the following findings. After adjustment for potential confounders, air pollutants PM10, nitrogen dioxide, except PM2.5 was associated with diabetes prevalence. The prevalence of diabetes was 8.93% and the mean HbA1c was 8.67, whereas the concentration of PM10 was 156.12 microgram per cubic meter, NO2 was 5.43 microgram per cubic meter, and PM2.5 was 25.36 microgram per cubic meter. The prevalence of impaired fasting glucose, impaired glucose tolerance, and diabetes increases with an increased concentration of air pollutants. By applying Pearson's correlation coefficients for air pollutants, that is the R value of PM10 was 0.163, P value was less than 0.001, and for PM2.5 R value was 0.001 and P value was 0.965. For NO2, R value was 0.149 and P value was 0.001 respectively. By applying stepwise logistic regression analysis air pollutants PM10 and by adding the duration of exposure to air pollutants by adding PM2.5 air pollutant and by adding NO2, the authors wrote that we found that long-term air pollution exposure was associated with impaired fasting glucose, impaired glucose tolerance, and prevalence of diabetes mellitus. The researchers concluded that this study can be used as a good evidence that air pollution is an important and manageable risk factor for diabetes. Hence, there is a much need for awareness about air pollution in the society and at the government level. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.